you can see the video manual, and inside the manual you can find step-by-step all the procedure, but I suggest you to scan the QR code and you can see the video manual anyway. May I give you, thank you very much. As I told you at the beginning of the procedure, you can start without gloves because you are touching only outside of the drape, and so we can open the pack. You can extract all the material, and now we are touching only the outside part of the drape. You can open without surgical gloves. You can see like this. You pay attention only touching the outside part, not the inside part, only the outside part. And from this moment, okay, you have to dress the sterile glove. Okay, now I take the sterile glove. Thank you, 7.5, perfect. Sorry, Arietta, scusami ma non so dove buttare la roba. Okay, now I'm putting on the sterile gloves. And now, thank you. And now we can open the package inside. I suggest you to maintain all the material in the slots so it's more easy to perform the procedure. Open like this. Okay. Here you have the drape. Okay. Here there is the cap. In one cup I put the cap of the needle, and I know that in this cup I will put the anesthetic solution. Now we are going to prepare the anesthetic solution. I need your help, please. You put here 10 ml of lidocaine without epinephrine. Arietta, per favore, non so se loro sentono, capiscono bene. Okay, now we are preparing the anesthetic solution.
Intanto vado io anche a controllare se si sente bene.
Okay. This one is lidocaine?
Yes.
Without epinephrine?
No,
No, I want 10 ml of lidocaine without epinephrine.
Okay. Why do you prefer the without?
Because I have to add epinephrine after that in the right amount.
Okay. Si sente benissimo comunque.
Perfect. ml.
Ok.
Secondo me se lo fate in due è meglio, se no non finiamo più qua. Vai ad aiutare, apriamo le fiale. Sì, sì, ok, open. I need 10 ml.
Tamam. 10 cc. 10 cc. Tamam. Tamam.
Take a syringe of 10 ml. You have a syringe there. You can take the syringe, 10 ml, and fill it up.
Buraya boşaltıyor. Çekip buraya boşaltacaksın.
Tamam ama steril değil, sen boşaltabilirsin.
Yok değmeyeceksin. Kaba boşaltacaksın. Enjektör.
With injector. Okay.
Enjektörle çekmek lazım.
No, but here is so slow. You put in one syringe, 10 ml, and then you inject here.
Bir dakika dur, biliyorum ya.
Ha tamam.
Sen
Acele ediyor da onda. Kusura bakma.
Perfect. Okay. I remind you the preparation of the anesthetic solution. In this case, we are prepared the anesthetic solution with 10 ml of lidocaine without epinephrine. We put 30 ml of Okay, this one is 10 ml of lidocaine without epinephrine. After that I need 30 ml of saline solution.
Salini açar mısınız?
Saline solution.
Bir de şuradan bak.
So we put 30 ml of saline solution. And after that, and so we have 40 ml of solution, 10 of lidocaine and 30 of saline solution. After that, we add 0.4 milligram of adrenaline, 0.5 milligram, and the same of 0. ml of epinephrine. 30 ml of saline solution. 1, 10, okay. Okay, 20. And finally 30. Okay. Now, with the, and now we add in this solution 0.4 ml of adrenaline.
Now adrenaline.
Yes, you can put the needle here.
Okay.
And with the insulin syringe, you collected 0.4, sorry, 0.4 of adrenaline. Correct. And then you inject here. Now here you have a solution 1 to 100,000 of adrenaline. And now we put here, please. No, it's okay. Nothing more. Here, please, you can put the disinfectant.
This is usual for this.
Yeah, it's okay. A little bit of disinfectant, okay? It's enough, thank you. Okay, now we are going to prepare and in this, here you put only saline solution. It's enough for 20 ml. 20 ml of saline solution here. And for this reason, I put the cap of the needle here, because I know that where there is the cap, I'm sure that here there is an anesthetic solution. Otherwise you can, here, you can do a mistake, it's enough. Can do a mistake with the saline solution, because the same color. Okay, now, per favore, please move this one so I can start to... Yes, please. It's enough. Okay. Now we disinfect the area where we are going to harvest the tissue. Okay. This is the area where we are going to harvest the tissue. Now we put the drape. Okay. You know that in the device there is this kind of drape with the adhesive part, and so you can put in the area where you are going to harvest the tissue in this way. Okay. And so this is the area where we are going to harvest the tissue. Using the small syringe and the small needle, you perform a puff of anesthetic solution in the border of the harvesting area. In this case, you make here a little puff of anesthetic solution. It's enough, just a little amount, like this, okay? Then, with the 18 gauge needle, you perform the hole here, and with the tip of the needle, re-enlarge a little bit the hole of the entry point, okay? It's enough like this. Well, now we start injecting the anesthetic solution. We use the vac-lock syringe. Look, the vac-lock syringe. The vac-lock syringe is a special syringe that have the plunger. This is the teeth. You have one part of the plunger is free, okay? And one part of the plunger that have this kind of step here. When you inject the anesthetic solution, you use the plunger in the free side so you can move the plunger freely, okay? So, fill it up with anesthetic solution. Connect the cannula, the same cannula that you will use to cover the tissue. Insert in the guide. Remember, when you insert the vac lock in the guide, the right vac lock is upward, okay, in the side of the blade. You can insert like this, and then you lock here posteriorly. Here, click. Okay, now it's locked inside the guide. Well, now you penetrate in the little hole you make in the skin of the patient, okay, 15 millimeters. This one is the safe procedure. No more than 15 millimeters. It's impossible to go deeper than 15 millimeters. After that, rotate the system and insert all the cannula inside. And then we inject slowly the anesthetic solution. Okay? Very slowly, so it's painless for your patient. One. The second one. Okay, connect the cannula, insert in the guide, vac lock face up, lock posteriorly, and the same thing. Introduce, rotate, and insert your cannula. The second syringe. Okay. We go with the third syringe. Connect the cannula, insert in the guide, lock posteriorly, okay? And again, introduce, rotate, and go under the skin. Okay, the last one. Okay, the last one. I maintain a little bit of anesthesia just for the injection, and so I collect a little bit of anesthesia for the injection. And now the last one syringe there. Okay, just a little bit. And now at the end of the injection, it's very important to wait 10 minutes. So now we start 10 minutes. We have a clock here, and we start the time.
Sono 12:48.
Okay. The waiting time is important not for anesthetic, for the anesthetic of the area, because as you know, the lidocaine work immediately, but you have to leave time of the adrenaline to perform the vasoconstriction, and so you have to wait 10 minutes in order that the adrenaline start to create vasoconstriction in the area. Okay? And this. Come va, tutto bene? Gli hai chiesto come va la ragazza?
Sì, gli ho chiesto, ho detto se sentiva un po' di dolore, me l'ha detto pochissimo.
Pochissimo, bene. Ok.
Il sistema comunque ho sentito pochissimo dolore.
Bene, bene, bene. Mentre aspettiamo, in the meantime that we are waiting 10 minutes, I will show you again the mechanism of the vac lock syringe, because it's very important to understand how this syringe works in order to facilitate the procedure. As I told you, the vac lock work, you can see there is like a tooth inside the plunger here, and when you inject the anesthetic solution, of course the plunger must be free, and so you use the plunger in this part without any step. This step, you use this step only when you have to harvest the tissue. And so now when we are going to harvest the tissue, we put the teeth in where there is the teeth. And when you insert, you pull the plunger, rotate clockwise, and the teeth of the syringe stop the plunger, and so the plunger stays in aspiration, okay? Of course, this movement, this kind of movement you have to do when the cannula is inside the patient, not when it's outside, of course. Otherwise, you don't have any kind of negative pressure in your syringe. Purtroppo non sentiamo se vogliono fare delle domande, perché io se hanno qualche domanda.
Sorular varsa diyor maalesef oradan duyamadığımız için sorular varsa telefonla da alabiliriz aslında. Possiamo prendere anche tramite il telefono.
Okay, if you have any question in this 10 minutes, you can share by message or by phone, and so I can answer to your questions.
Evet, WhatsApp'la.
WhatsApp'tan görüntülü bağlan.
WhatsApp'tan görüntülü bağlan, ben buradan halledeyim.
Çok gerek yok. Bir şey yapalım. Santo şey
Perché ha messo solo il bicarbonato?
Perché non ho messo sodio bicarbonato? Com'è la domanda, scusa?
Ben soruyu çok iyi anlayamadım.
Şey var ya, karbonatı mesela, like to mesela anesthesia, why you don't use the yes.
Actually, you can use bicarbonate, and you can reduce the burning of anesthetic solution. Could be just a little drop of bicarbonate is possible to add to anesthetic solution. The only thing that if you put too much bicarbonate, you have a deposit of bicarbonate, and then when you inject with a small needle in the face, the needle can clog. But anyway, if you put a little amount of bicarbonate, it's good just to reduce the burning of anesthetic solution.
I wonder also if bicarbonate is affect stem cells.
No, I don't think that can affect,
okay.
no. And in any case, we wash out the tissue after the extraction, so there is no any concern about the interfere the bicarbonate with the stem cell.
We have some patients. I asked same question, but a little bit different. For example, in the abdominal area, she or he did for the liposuction some irregularity. We harvest this area can be a little bit to reduce the section. The irregularity is.
Scusami, una domanda, bir soru. Hanno chiesto se prende, hayır şeyi soruyorlar, telefondalar da o yüzden söyledim. Solo prende da una parte o da tutti e due parti?
Okay, I answer both the questions. The first question is if in the area there is some irregularities. Of course, when you harvest the tissue in very superficial layer, maybe you can correct this is irregularity and could be better for the patient. You cannot promise that this one is, but in any case, something is a little enhancement in the quality and the surface of the skin. And the second question, if I harvest in the trochanteric area, if I harvest only one side, the answer is yes, because you are harvesting very small amount of tissue and in very superficial area, so you don't have any concern about irregularity or asymmetry. And as I told before, if you see your patient from the back in standing position, all the patients have a side that is a little bit more than the other side. And so you start in the area where there is a little bit more tissue, and so, but don't have any problem about asymmetry. You harvest only in one side and it's enough, and not have any concern about the asymmetry.
Kaç dakika oldu?
Evet, kontrol ediyorum. Daha var. Sto contando.
Yeah, I suggest you, when you perform this procedure, wait 10 minutes, but 10 minutes, not wait a little bit, 10 minutes. And so you have to check with the clock, because of course 10 minutes when you have to wait is a long time. The feeling is a long time. And so if you don't check in the clock, maybe you start too early or to harvest the tissue. You have to wait 10 minutes. This is the right time in order to have a good vasoconstriction. If you see after 10 minutes you start the blanching of the skin, you can see the skin have some blanching, and this is show you that the adrenaline is working, because you have the vasoconstriction. You can see here the blanching here, and also the blanching around the entry point. Ah, dopo ti chiederei se è possibile, hai degli steri strip, ce li hanno degli steri strip?
Steril striplerimiz
Sì,
var
per
mı?
chiudere qua, per chiudere un
Aynen,
pochino.
oraya kapatmak
Perché
için.
glielo chiediamo.
Vardır burada mutlaka vardır.
Dur, ben
Canım.
sorayım.
Zaten evet biraz sonra sorun.
Kesinlikle vardır.
E ascolta, già che ci sei, steri strip e un paio di forbici.
O bu herif var.
Steril
Sì.
maddesi.
So I will show you how to the medication for the harvesting area in order to reduce the chemosis and the swelling from the harvesting area. I will show you how to put the medication here.
If you want to do the same at the same time face and also hands, can we take the double size?
Yeah, of course, it's possible. No, yeah, no problem. You can, but as I told before, or to our other colleague that asked the same thing, of course you can harvest in the both sides if you need more tissue. It's possible. In my point of view, is to try to make this procedure is easier and more comfortable as possible for the patient. And so, at least at the beginning, for the first treatment, I prefer to perform a very quick procedure, only one side, in case I can split the procedure in two procedures, just to make the procedure as comfortable as possible for the patient. If you have to harvest the tissue in two sides, it's a longer procedure, it's more invasive for the patient, and sometimes, if it's the first treatment, sometimes the patient can have not a good feeling for the treatment. And so at the beginning, step by step, if the patient take confidence of the treatment, you can harvest in the both sides, make a bigger treatment. But at the beginning, I suggest you to make the procedure as shorter as possible, as simple as possible for the patient, in order to make this confidence of the patient about the treatment.
Son 10 minuti.
Perfect. Okay. Now we start the harvesting procedure. The same syringe, the same cannula. You connect very well the cannula with the syringe. Okay. And now you insert in the guide. Remember, back lock face up in the same side of the blade, and lock very well posteriorly the syringe. Okay, click. This one is the concept. Then you insert in the hole, enter with the cannula. Okay. Then when the cannula is inside under the skin, 15 millimeters, you pull the plunger and rotate clockwise. Okay. Now the system is locked in aspiration. Okay. Now the only thing that you have to do is move back and forth like this. And you can see that the tissue enters in the syringe. Very easy, very safe. This one is the treatment. You can see the tissue entering the syringe. You move back and forth. When you have 5 ml of tissue inside the syringe, you can stop the procedure and you transfer your tissue. 5, 6, it's up to you. It's not important the amount anyway. You can see the tissue is fluid because the cluster is small, and this is the concept, okay? Okay.
In the last course,
You have 5, more or less 5 ml. You take the syringe, you take off the cannula, you remove the air inside the syringe, you take the transfer without any filter, you put the transfer, don't lock too much because and then you take thank you very much, the reservoir syringe, you transfer the tissue in the reservoir syringe, then you fill it up with saline solution, you cap the syringe, and you put in the decanting slot. That's it. And now you can start with the second syringe. Connect the cannula, insert in the guide, okay, lock, insert, pull the plunger and rotate clockwise, okay? The system is on. And now you start harvesting the second syringe.
Se qualcuno non volesse usare la guida,
It's up to him, but anyway, you have to be sure that you are harvesting the superficial layer of tissue. And so, if you have the manuality, you have the skill to harvest only the superficial layer of tissue, and you can perform the procedure in very standardized way, you don't use the guide. But, and so, for example, if you are a surgeon, you know very well the plane where you harvest, if you want, you cannot use. But this device is designed for medical doctor without liposuction skill. And so to be sure to harvest only the superficial layer of tissue, it's better to use the guide. Otherwise, you go deeper, you can hurt the patient because you can touch the fascia, and so on. And so I suggest if you don't have a surgical skill or liposuction skill, use the guide. It's more safe and more effective.
perché io ho visto qualche chirurgo plastico che sta usando già il kit in selfie, però non hanno usato la guida.
As I told you, if you are a plastic surgeon and so you use the device and so you have the skill to harvest only the superficial tissue, you can avoid to use the guide. But this course, this workshop is for doctors without any surgical skill. And so we suggest to use the guide. Okay, remove the hair, you transfer the tissue in the reservoir syringe. Okay, perfect.
Comunque strip, il forbice sono pronti.
Okay, fill it up with saline solution.
Solution is not enough.
Saline solution, it's enough, okay? Cap and put in the decanting slot. The last syringe.
Do you want more solution?
Oh,
Saline?
actually, no, I think that it's enough maybe, but in case. Okay, the same thing, okay? Lock very well, okay? Then you pull the plunger, rotate clockwise, and the system is okay. And now the last one.
Se volessimo prendere più materiale,
You can harvest more material, or you change the area. You can harvest in the other area. But as I told before, I prefer in the first treatment to perform a procedure less invasive and more comfortable for the patient. And in this case, you have a lot of material. In case you want more material, you can use also this syringe for decanting, or you can move the tissue in one syringe and you have one syringe free.
Per esempio, prof, se volessi fare i capelli, il viso e le mani, la stessa seduta, cosa dovrei fare?
Sizde sorunuz.
I don't suggest to do too
Ben
much.
aynı seansta aynı şeyde saç, yüz ve el üstü çalışma yapmak istersek ne yapabiliriz? Onu sorun. Evet.
Again, my suggestion is not to put too much treatment in the same patient, in the one session, because otherwise this kind of procedure became too invasive for the patient. I suggest to split the treatment. At the time, for the first time, after the patient have confidence in the treatment, you can use, you can of course, you can make a bigger treatment. But at the beginning, I suggest to split the treatment. In case you want to treat the hair and the face, I suggest to use the Seffiline because you need the tubes for centrifuging, and so this is the, and then of course you have to have a small tissue.
Now, more redness.
Yeah,
Yes.
but it's not a problem.
Yes, yes.
No, it's not a problem. The redness of the tissue is not a problem. As I told you, don't wash more than one time. Okay, this is the last one. The same procedure, take off the eye. Now, here we have finished. Now I show you how to make the medication here. Okay. Now, mi dai anche le forbici che preparo con
Qualche solo una versione
le forbici e quel nastro che ho preso là con l'arancione. Sorry. Ok. Now I show you. For this area, you put only Steri-Strip to close the hole like this. This is enough. And then this one is a kinetic tape. I don't know if you know this kind of drape. It's a drape that used the Sportman guy. It's very useful for this treatment because it makes a lymphatic massage and avoid any ecchymosis. Okay, you have to apply like this. When you apply this drape, you attach the drape without tension. After that, you make 80% of tension and you stop without tension.
È arrivata una domanda, stanno chiedendo se si può fare la stessa seduta, l'acido ialuronico cross-linkato o non cross-linkato, la stessa seduta.
Of course, yes, as I told you in the presentation, you can perform the hyaluronic acid in the same section, cross-linked or not cross-linked. If you perform the cross-linked, I suggest to inject the hyaluronic acid before and a little bit deeper, and then you close the section injecting the hyaluronic, the Seffiline in the most superficial layer, okay? And this one not cross-linked. If you want to inject the no cross-linked, you can mix up with the Seffiline and inject with the same syringe. Of course, as you know, when you mix up two substances, you are performing off-label treatment, and so when you use the non-cross-linked, you are only used to enhance the volume of your material, and so I suggest you to put in the same syringes, okay? So when you use the cross-linked, you put a little bit deeper of the Seffiline. When you use the non-cross-linked hyaluronic acid, you can mix up with your hyaluronic, with your Seffiline in the same syringe. Okay. This medication I suggest to the patient to remove by herself after 3 days. She can remove everything and that's it, nothing more than this.
Tony, I want to ask another question, maybe a little bit absurd. Under the mental area, some patients have a more fat.
Here.
So we combined this. Do you advise?
The problem is that, okay, puoi dire che si può vestire.
Di
The problem is to harvest the tissue in this area. I think that you need a surgical skill. It's not easy to remove fat in this area. So if you are not surgeon, I don't suggest you to remove the fat here because it's a complicated area, and so I don't suggest you to use this area to harvest the tissue.
Bir de oradaki kalınlık 1,5 santimden az.
Può fare la doccia tutto quanto?
Sì, può fare la doccia.
Cerrah almadan
Ti fai un po', farla venire in su per favore, e poi vorrei il letto seduto.
Oraya başlayacak böyle.
Yüze geçecek şimdi.
Yapıyorsa
Ok.
O istirham. Va bene così?
No, più seduto.
Più seduto?
Perfect.
Ok.
Okay. In this patient, we are performing treatment in this area and in this area, and so I suggest you 2 entry points. One entry point will be here in the zygomatic area, just to treat this area, and a second entry point here to treat this area and this area, okay? In this case, I'm going to use a 20 gauge cannula, this cannula, and I will perform a fluidification of tissue with 3 passages, and so I'm using 600 micron tissue. Yeah, this one you can look. Now we discharging the tissue.
Un attimo solo che devono spostare la camera così lo vogliono vedere.
Ok. Allora aspetta che ci sono.
Surat almayacak.
Alacaksınız. En yakın sizin için en güzel. Nasıl
Tamam.
olursa yani
No,
en
only
içeri
that I want to
bildiğiniz
show
konuda.
this part. Then by
şurayı
one.
gösterebilirsin değil mi? Çünkü siz
Stop one moment because I want to show one thing before you discharge. Thank you. Okay, now he's discharging the liquid part. Remember one thing. Wait a moment because I want to show one thing. Okay.
Yani buradan olursa şimdi biraz sonra hoca o tarafa gelecek.
Tarafı gelecek çünkü onun için.
Bu taraftan olursa iki tarafta güzel görebiliriz.
Okay, thank you. In the syringe,
Sorry. One minute, please.
yes.
Oldu mu? İki taraf biraz daha.
Aslında siz o taraftan gidip baksanız Bey, hani görüntünün ne kadar net olduğunu, ne kadar olması gerektiğini ona göre ayarlansa.
Okay. Can you?
Sorry.
bu tarafa çevirir misin?
Şuradan göreceğiz.
Hocanın eline.
Şey, anladım. Biraz daha
You
sonra
can see
ayakkabıya
here.
doğru gelebilirsiniz. Durun, bir ayakkabıya doğru biraz daha gelin. Oradan çekilebilirsiniz. Şimdi hocanın elini görüyor musunuz?
Bir saniye göreceğim. 10 saniye.
You can see the syringe.
Okay.
Yani hocanın elini.
Okay. After sedimentation, you can see here the liquid, the washing liquid, and here the tissue. The most important part of this tissue is this tissue, that is the layer that is in contact with the washing liquid. So when you discharge, here there is the highest concentration of stromal vascular fraction. For this reason, when you discharge the liquid, the washing liquid, it's better to maintain a little amount of washing liquid inside the syringe, but not risk to lose some cells of this side, okay? So stop here, don't discharge all the liquid, otherwise you are losing some cells. Okay, now it's here, wait, okay. The same thing here, we discharge only the liquid. Okay. Now we wait one moment and we start with the injection of the anesthetic solution. May I have some disinfectant for the face, please? Se qualcuno mi dà il disinfectant, please.
Disinfectant?
That one, yes, okay, it's okay. Okay, I used to perform a little bit of anesthesia also in the area of the injection. As I told you, I inject here, so the entry point is enough a little bit. Here, the entry point here, and a little bit in this area where we are going to inject the tissue. The same thing on the other side. The entry point here, the entry point here, and a little bit in the harvesting area. Okay, that's it. Okay. Now we return to our tissue, and now we start with the procedure of the emulsification. I told you that I'm using the 600 micron tissue, and so I need only 3 passages of emulsification. And so I transfer the tissue in a single syringe in order to have 1 syringe for emulsification. In this case, I transfer here, okay? And after that, 3 passages. 1, 2, 3. And the tissue is ready to transfer in the syringes. 1, 2.
Si può alzare ancora un po' il letto perché dalla camera non si vede bene. Sì? Lo alzo? Ancora un po'? Prof?
Sì, sì, va bene. Sì. And 4, okay? And so we have 4 syringes. Now we can perform 3, you can perform 3 passages here too, and I start to perform. Quanti ce ne sono qua? 6? Okay, sì. Okay. Now, sorry. Okay, turn a little bit like this. Okay. We start with this side, okay? We make the hole with the needle, and then we go with the. Remember, the injection is very superficial, okay? The concept is to sewing the cells under the skin. Is not fill it up. Is not a filler. Is a regenerative therapy. You are injecting superficial. You can go also close to the eye. Don't be any concern about that. Okay. 1, 2. The concept is to sewing the cells under the skin. Okay. Now, the last one on this side, you change the entry point. You go here. From here, you can go to the zygomatic area. And you go under the eye. When you inject here, with your finger, you protect the eye, and you can go up here, okay, protecting the eye like this, okay?
È una domanda, stanno dicendo perché stiamo facendo una terapia rigenerativa, perché non lo facciamo anche parte temporale e parte terzo e superiore del volto?
It's the same thing. You have, this is the first treatment for this patient. And so I wish not have a very heavy treatment. And so for the first treatment, I think that a very fast and very easy treatment is the best way. Of course, next time in this patient that is more confident with the treatment, you can add a little bit more tissue and you can treat also this area. With the regenerative therapy, you can treat everything. You can treat here. But the problem is that you have to balance the result and your treatment with the comfort of the patient. It's not a good way to try to have an over-treatment and lose the patient. Because if you have too heavy patient, okay, you can perform one treatment, wonderful treatment, but the patient cannot come back. And so it's better that the patient take confidence of the treatment, and step by step you increase the quality of your treatment. Don't think only about your treatment, think about the psychological point of view of the patient. Okay? The confidence of the patient is important. This one is a treatment that the patient has to perform every year, a couple of times. And so for her must be a very, very easy treatment, not too much. That's it. Okay? And now we are going to treat the other side. Okay? Thank you. Sorry. Turn the head like this. Okay, thank you. May I have another disinfectant, please? Thank you. May I give you this one? Thank you very much. Okay, the same thing. Inject very superficial. Okay, this is the key of the treatment. Injecting very superficial. Second syringe, please. Okay, the last one. Thank you.
İçinden mi çıktı setin onu merak ediyorum.
Yok, kanka ayrı. Şu sıra ayrı oradan attı. Kanka çıkmıyor.
Let me give you them.
20, 19, 21 onlar. Getiriyordu galiba.
İşte şu siyah kutular hocam.
You can treat diagrammatic
Şey
carriage.
için koymuşlar, maliyeti artıyor. Hepsini kullanmıyor. 18'ini kullanacak. 20 20. Onun için hepsini koysa olmayacak. Onun için
Hai un po' di crema dopo e qualcosa, una crema da poter fare un massaggio?
Sì, infatti, un attimo, glielo do io una crema.
Thank you.
Infatti volevo chiedere io che dobbiamo fare un po' di massaggio
Sì, sì.
per
Okay, that's
distribuire.
it. Now, okay, the treatment is finished. The only thing that I do after the treatment is a gently massaging the area, just to spread the tissue very well under the skin. Okay. And then I suggest to maintain cold pack in the area for a couple of hours, just for bruises or ecchymosis like this. And again, the concept is, for me, the patient can go to a dinner in the evening, and so the concept of the regenerative therapy must be the the best patient for the patient too. The best treatment for the patient too is have to be very, very light, very comfortable for the patient. The patient in the night, if you have a party or dinner, can go at dinner. And so, this is the concept. Don't over-treat your patient. Treat very light treatment, you have a result, and step by step you can increase the treatment.
Per la crema per massaggiare cosa bisogna usare?
Use
Qualche
gently,
arnica,
use gently crema.
Hocam çok
O arnica.
bir krem kullanıyor. Bizdeki Belogent. Gentalin Beta İtalya'daki şey Belogent kullanıyor. Ama biz şu anda elimizdeki
Okay. Okay. Cold pack here for a couple of hours. The patient can remove by herself the medication in their resting area. The drape can remove after 3 days and nothing else.
Buz geliyor.
Okay, that's it.
Al, biraz
Do you
daha.
close this area with we need?
No, you need nothing. Nothing. It's okay.
Tam yüzü karşıdan alalım şimdi. Aynen.
Okay, that's it.
Bir saniye hocam.
complimenti prof, un bel lavoro.
Easy, fast. The concept is the treatment must be easy, must be fast, must be okay for the patient, have to be a good result, and so she is stimulated to redo the treatment.
Totalde 15 cc.
Tamam mı? Gördün mü yüzü
Turkish
karşıdan?
patients wants more results in one session.
Şimdilik bir tane daha yapalım.
I know the other question are for example, our patient is more aggressive and more want to more good results in one session. What about you? How I tell the
You must educate your patient. It's not the patient that said you what have to do, but you have to say to the patient what have to do. So you have the will in your hands, and so you have to drive your patient in the right direction. I know all the patients want the best result in one section, but it's not this philosophy. The philosophy is to have a result and the aging treatment, but the patient has to redo the treatment, and so the constancy is more important in the treatment. If you perform a treatment too heavy, the patient will be scared of this treatment and then cannot come back. And so you have to know this one, and you can drive your patient, and you do the best for your patient. The best for your patient is perform a treatment that the patient have the feeling to redo the treatment. Not the patient. It's better that the patient ask after 3-4 months to have another treatment because okay, but what we do? Okay, we can do another treatment. But if the patient is scared, the patient, you can do only one treatment and the patient escapes. You have to maintain your patient, and so you have to educate your patient, and the will is in your hands. Okay, everything okay? Okay. Now you put a little bit of cold here and nothing else, okay?
Yani 15 dakika tut, ondan sonra yarım saat ara ver.